So the story, and Jason and Jacob will talk directly as patient and specialist along the way about what actually happened in the story that Jacob's had. And Tony Bartoni is the GP who's involved, who also works with us, who's in the front row. He might want to chip in along the way. The story is what raised my expectations, I guess, is a very different approach from something that wouldn't at the beginning seem to have been classic brain injury, concussion, head injury. And the way in which it was dealt with was, to me, exemplary. And I learned a lot from that and continue to learn from Jason and the work that he does in this area. So I'd like to welcome you, Jason, and you, Jacob, and I'll sit down and let you get on with your story. Thank you very much.
Thanks, Mukesh. Thanks, everyone. As Mukesh highlighted, I'm the Chief Medical Officer at the Melbourne Storm Rugby League Club and have been for about 10 years now. I'm a GP. I hold no other secondary specialist qualification. So anything I've otherwise learnt in this field has effectively been through my work of otherwise attending some talks like this, but also from a practical perspective in terms of the way in which we apply head injuries and concussion information through the NRL, and also what we otherwise see in practice itself. I've been a doctor now for about 30 years, and as such, as I said, I've done general practice for the better part of 30 years in that time. In early 2000, I started my journey as a sports doctor and took up a role at the Williamstown Football Club, where at that time we used to look after both the Collingwood and the Footscray Football Club. And I highlight that simply because back in those days, and many of you doctors, and I've seen a few doctors here who've otherwise been current doctors at AFL clubs and also ex-doctors at AFL clubs, we were back in those days, it used to be the fact that, you know, she'll be right, literally only 20 years ago. She'll be right, go back out there, you're not too bad, how many fingers sort of type scenario. And things have changed a lot since that time. To the point that when I took this role up at 10 years ago, my first contact was one of the speakers today, and it was Michael McDeasy. And I arranged to speak with Michael to say, hey, I am shitting myself. I'm about to go upon and embark on this journey where these big, brutish, 130-kilogram men are going to act like raging bulls against each other and they're going to get head knocks, and I have no idea what I'm talking about. And Michael was great because he met with me and we spoke for a couple of hours, and I left that meeting feeling terrible because what I did know then was the fact that we don't know a lot. And there's so much in this field that we actually don't understand at this point in time. So much about what we do right now is all about harm minimisation. And there is no doubt, and some of the words that I may otherwise say may be somewhat controversial, but in my belief, concussion has got two stages or two parts to it. There is perception and then there's reality. Perception is otherwise what everyone thinks, and the reality is what we actually deal with. When we deal with a head concussion in an NRL situation or a HIA, we have an independent doctor who's looking over video, and they'll look over that video 20, 30 times sometimes before making a ruling. We'll categorise them, Category 1, Category 2, Category 3. They'll then come downstairs, we'll spend 15 minutes with them, 5 minutes to be left alone to get their breath. We'll have 10 minutes to otherwise do a Scat 5, which in your office, in untrained hands, will take you 15 minutes to do. We then need to make a decision as to whether someone can otherwise then go outside and play. They go back outside there, they're tired, they're fatigued, they're questions that we see on our Scat 5. We then have to see them after they have their game. We do another Scat 5 before they leave and discharge them in front of someone who actually knows what they're talking about. Within 36 hours, we will do another Scat 5 on those people. If they're diagnosed with a concussion, they'll be seen on a daily basis. We'll then check their vitals. We'll see a physiotherapist for their cervical neck work, and they'll be taken through a range of VOMs, head, neck injuries, a whole series of circumstances. And on a daily basis, they'll be ticked off. At around about day 6, although it's extended a little bit more now, they'll do a cognogram. They'll otherwise then check all of these being done prior to the pre-season situation. If the cognomagram's otherwise okay, which they will have had to have passed at 3 attempts before they otherwise have to see a neuropsychologist to confirm that it's otherwise okay, they'll then go and then they'll go into contact. And then they'll have to see me again before I can otherwise tick them off before they play a game. We have young Jacob here. Jacob's a young 16-year-old boy who's not unfamiliar in terms of, well, not dissimilar to what we find in the community. He's a hockey player, not a sport you expect to otherwise have in a situation where you'll get a concussion. He plays against men because he's that good. So he'll play in the Premier League. And this is not an aspersion, it's to say he's a small, slight person with an immature body playing against men. where the narrative effectively is you've got to be tough, you've got to get through, and we don't want you in a situation whereby you're going to complain if you want to play with the big boys, because the big boys have been doing it forever. I saw Jacob in April of last year, and he came along with his mother, which was a wonderful circumstance, because in these situations where I have the luxury of having baseline SCAT-5s, baseline cognograms, and I probably had about 10 spotters at any point in time, often you'll find these kids will come otherwise in on their own, not really knowing why they're there, although they do know they've got concussion apparently, but we don't know anything about them. And so when I saw Jacob in April of last year, he came along with his mother, who asked him to tell his story. Jacob, how are you?
Good, good.
Good, mate. Good. Can you please take everyone through in terms of what happened back in April of last year and how you sort of went from there?
Oh yeah, sweet. So basically, yeah, I play hockey. It's not really, as Jason said, not really a common sport to get concussion, unless you usually, like most people think, like, oh, you get a stick to the head or a ball to the head, which yes, it still does a lot of damage. But my injury was a bit different. So I was basically playing in the midfield and I was reaching out to go get a ball, and I was fully extended, and this 24-year-old fully sized built guy just came through and ran through me. And he got basically his shoulder underneath my ribs, just underneath his shoulder, and I went flying that way. And I hit the ground. However, I got back up and I was like, the game stopped, obviously, it was my free hit. And I got back up and I was like I was fine. I was a little bit dazed, obviously, because like I've just been hit by this, 80-kilo bloke. But we got back up, we ended up scoring a goal, celebrated, and then I came off for my next rotation. And the first thing, hockey is a bit different to most local league sports. Like obviously it doesn't have that big of a funding. So we have a team manager, and she's a lovely lady, but I don't think she actually has any qualifications as like a doctor or GP. But yeah, she came, sat me down, and the first thing I remember they were asking was, they lifted up my shirt and checked my ribs straight away. That was the first main priority. They thought I'd broken a rib or something, or there could be bruising, something serious. And then the next thing they chose was my shoulder, checked was my shoulder. The shoulder that I landed on, it absorbed most of the impact. So there was nothing about any head incident. And to be honest, I didn't really indicate any of it because this was actually my debut, so I didn't really want to say anything. Like I just wanted to keep playing. Very foolish of me, however. But yeah, so they checked my ribs, they checked my shoulder, nothing about the head. And so yeah, I went back on, played the rest of the game. I felt okay, like obviously by the time this happened I was a bit tired because it was late in the quarter. But yeah, played out the game, didn't have any episodes or anything, finished the game. The game was in Geelong. I live in Altona, so I ended up driving home on my learners and somehow managed to drive fine according to my dad. And then so that was Saturday, and then Sunday I have this state program which is called the Hockey Victoria Academy, and it's for junior athletes trying to push for the state team. It's pretty competitive, it's like 2 hours. Sunday's always match play, so it's just 2 hours of competitive match play. 18-year-old blokes just going up against each other. I went through that, played through that, fine. And then after that I came home, had a shower and then went to bed. My mum said it was just because I was usually pretty tired, like I'm only 16, so just finishing up puberty really. And
Finishing?
Yeah, starting, same thing. So yeah, I just kind of went to bed, and then I got back up and I had a haircut appointment. And I remember going to my haircut appointment, and it took took longer for some reason. Like he stuffed up my haircut the first time, so I asked him to do it again. And then on the way home in the car with mum, like I was just, according to her, I was really agitated and frustrated, a bit more than usual. And then when I got home, I tried to do some schoolwork. I was in year 11, so it's kind of getting close to the serious part of year 11, year 12 VC starts. So yeah, I tried doing some schoolwork and I just couldn't concentrate at all. I had a really bad headache and I had a sack on Monday, so I was like, oh, I'll try and get it through, but I just couldn't do anything. And then I ended up like having some dinner. Didn't really say much at the dinner table. Had dinner, went to bed, woke up the next morning, tried to go to school because I knew I had a sack, so I wanted to go get that done. Got through the first 2 periods of school and like I couldn't concentrate, had the worst headaches, really tired, really fatigued, felt even a little bit nauseous. I ended up going to health centre, and the nurses, I told them that, like, yeah, I did have a hit. I told them about the incident on Saturday, and they were like, oh, this could be a possible concussion. So they called up mum, they said, yep, take him out of school, don't worry about the sack, go see a GP straight away. And that's when I ran into Tony, and he did the Romsberg test. I don't know if any of you have done a Romsberg test, but basically it's just like to test your balance. I stood outside the car with my hands and feet together, closed my eyes, and straight away I was standing like this and I tilted. Luckily Tony catched me, otherwise I could have had more damage. But yeah, basically from then on in, I just got diagnosed with concussion. I actually wrote some notes, so yeah, this was Monday, day 2, so this is 2 days after the incident. During this, I kind of felt like really foggy in days. Like, I don't know if many people have had concussions in here, but it's kind of just a weird feeling of just like, you're just roaming around, kind of doing nothing. Like, you don't really feel like you're a part of anything. So yeah, once day 3 and day 4 happened, which was Tuesday, Wednesday, I kind of just rested up. That was the advice that Tony gave me, just no screens, no school, just close and rest your eyes. Slept a lot that week. Then Wednesday came around and I got up to go downstairs, go to the pantry, get some food. I've actually ended up walking into a door. And Dad and Mum were pretty concerned about that because symptoms weren't really getting better, so they sent me to go get a CT scan. Then Thursday, same thing again, I just slept. Friday, I saw Tony again, and we went through the CT scan results. Now, to be honest, like, I've got it here that I saw Tony, but I don't actually really remember the Friday session with Tony. But yeah, we went through some tests. I'm sure Tony will be able to tell me what tests I exactly did, but yeah, that was a bit like challenging because the CT scan came back all good, thankfully. But yeah, that's when he followed up and prescribed me on to Jason. So I saw Jason on the Saturday or Sunday? Monday? Saturday?
Was it Saturday afternoon?
1 o'clock was your last appointment.
There you go.
I didn't think I worked Saturdays anymore.
You were doing a special session.
Oh, there you go. That's right, yeah. I do remember.
Yeah, so yeah, I met Jason on Saturday, and this has probably been a week, exactly 1 week from the incident, and symptoms were not looking good. And then I went and saw Jason, and he did a couple of tests on me, and I'll never forget, like, I was doing SCAT 5 and also balance tests, and throughout the test he'd be like, good, like, yep, good, continue on, and like, it was giving me like false hope. So basically, like, after I did all the testing, it was a good solid like 15 minutes of tests, and he just said, geez, this is shit.
They would have been my words, actually, too.
Yeah. Yeah, and he explained to me, and then the worst thing was like finding out how long I was out for. I found out that I wouldn't be able. He said, estimated that I probably wouldn't be able to play hockey for another like month, and I was like, oh, no way, like, that's just not going to happen.
If I could just interject quickly, I've just got his SCAT 5 here. For those of you familiar with the SCAT 5, he was positive in 19 symptoms at a score rate of 57. Time, place, person was 3 out of 5. Short-term memory, 21. Reverse numbers were 2 out of 4. He was unable to get the months in reverse. His balance effectively was 3 with 2 legs standing, single leg was 1, and his tandem gait was sitting at 5. He had no dysautokinesis, and his delayed recall was 3. Just to let you know.
Yeah, so probably not the best results, but and I think that kind of came to a surprise to both myself and like my parents as well. Like, because obviously I wasn't really saying much, I was just sleeping, but in terms of like the actual cognitive capability, like, it was a bit of a shock, really.
It's interesting when you do these situations, you have and as I said, I had Eleanor sitting there at the same time, and you're doing the testing to Jacob, and he's thinking, this is great, he's doing really well and remembering everything, and, you know, July comes after September sort of type thing, and you look at Mum, and Mum's just going, like, they really get very worried because all of a sudden they know. And see, in situations like this, you don't have no baseline, and then you're dealing with a kid for the first time, or a person for that matter for the first time who's never done this test. So there's no learning process. You know, some of the guys who've done AFL before, that you'll know that when they talk about we do our names or our words to remember, they'll read them all off before you've even told them what they are. They remember what they otherwise are, essentially. So when Jacob was doing this and you see mum just go, oh my God, you don't know how to, you know, 4 numbers in reverse sort of type circumstance, it's actually quite distressing for them.
Yeah, and then also seeing Jason, he also basically described like what actually happened in terms of the concussion with the incident. So he basically explained to me that the way I got concussed was from the whiplash motion of my neck from when the guy basically ran through me, and the force of my body just kind of like jolted, kind of like what happens when you're in a car accident. And he, like, I'll never forget the stat, he said that like for young adolescents, like, yeah, size of your head is like twice, if not even more, like heavier than the size of your neck. So therefore, like, those whiplash mechanisms kind of occur, and they're pretty common in concussions for young adults. So yeah, that was a bit of a surprise. And obviously it meant no physical activity, because we didn't really know. He also explained how different acute responses, such as like raising your heart rate and blood pressure, can actually cause more damage as well. So it was a bit frustrating. I kind of just had to lie in bed, close my eyes, no screen time either, which kind of sucked as well. But yeah, so yeah, felt like I was falling behind, obviously in school, hockey, which isn't really good because that was basically my life back then. So then Monday he referred me to this specialist physio. His name's Chris Tandy, and I'm pretty sure Chris used to work with Jason at Melbourne Storm. And yeah, he was an absolute legend. He helped me get back on track by doing these really kind of strange exercises. He helped me first with my ocular ability, so he just like give me some ocular exercises about like just following my finger and my eyes. And he also gave me some neck exercises, and they look kind of silly. They look like sit-ups but with your neck. But yeah, so he just gave me those, and we saw him on the Monday, and we ended up seeing him a couple of days later, and like already my symptoms had improved quite significantly just with doing those exercises. And then from there, me and Chris and Jason, we kind of came up with a plan, a graded return back to sport. So it consisted of doing these exercises and then occasionally just like taking them a bit further. So, you know, I'd do like 3 sets of neck exercises, and then I'd do like 5 sets of ocular, and then the sets kept increasing. By the end of it, I was adding a bit of weight to it. And then, yeah, if no symptoms were occurring, then I could be able to do like a 10-minute walk. That was the first graded return. And then after that, it went to like a light jog. Then it went to a bit more of a higher intensity jog. Then it went to actually being able to like pick up a stick and do some just basic stick skills. And then some more high intensity running, just like normal running. And then eventually I could do an actual training session, but still no contact. And then eventually, after like 39 days, I was able to play my first full game again. But over that time, I think I saw like Tony 3 times. I saw Jason about 3 times as well. I saw Chris about 6 times. So it was a lot of steps that took to get back to playing. But yeah, it was really, really beneficial.
I guess for me, the important thing, being a clinician out in the community, is for all of us here, we probably aren't the problem because we've all got an interest and we've all taken that sort of step, if you will. It's more a circumstance of, like most GPs in some respect, we've all got our armoury of tools that we otherwise use, and the key is to otherwise make sure you have someone that you can refer to. It's all and well to say, you know, if in doubt, sit it out, but it should include that circumstance of saying, if in doubt, sit it out and defer to somebody else who knows. And I think that's probably the key here. If you find in your experience that someone's settling down as well as they otherwise should be, then fine. And if they're not and they're deviating and you aren't sure, then you need to be going to see somebody else. I'm fortunate enough that I'm otherwise in that system, so we otherwise have access to these peoples, and we can otherwise, we know what's right and what's wrong, and we know who is good at doing their job necessarily. We all know physiotherapists, we all know, you know, optometrists, we all know, perhaps even you're lucky enough, you might know a couple of psychologists as well. But you need to make sure that you have someone who not only has an interest, but has a level of expertise that you understand. It doesn't mean that they're getting it wrong, and as some of our presenters will otherwise say, there's so much in concussion and the rehabilitation part that we don't fully understand. You know, we talk about the fact, and I asked Jacob to otherwise have some rest, but we know sometimes we still, you know, where in the past we wouldn't allow them to do anything until they were symptom-free, we now know that we don't wait for that particular moment, and we'll get them to exercise before they're symptom-free at this point in time. Certainly some of the physiological elements are still the same in terms of blood pressure rising and following that graduated return to play, which is otherwise within the SCAT system. But I think it's a really important thing that you otherwise have a level of what you're going to do when you see someone come in with a possible concussion. If I said to you, I have chest pain, immediately everyone in this room knows exactly what to do. If I say to you, I think I've got a headache, the first thing you're trying to do is to say you're fine. You might be dehydrated. You might otherwise, you slept late. You had too many to drink the night before, not enough sleep, you're worrying about an exam. But in the community circumstance, it should be the same thing. Headache, any of those symptoms effectively, and there's a list of symptoms, 22 symptoms, and you'll pick up, in my experience, and I'll defer to smarter people than me, but my experience is the fact that I will pick up within those symptom controls, I'll pick out 95% of my concussions immediately, if I don't already know the person. If you know nothing more and do the balance and all that other stuff that you otherwise do, you'll pick up most of those things within that symptoms and that time, place, person, the Maddox questions even still. So the important part is not to be scared. The important part is to embrace it and say, recognise where your limitations otherwise are. And if in my experience the fact they should be better in 2 weeks, but they're not, then I need to send them to somewhere else. So like I said, everything that we otherwise learn at the club or we do at the club is exactly the same as we otherwise should do in the community to even more vulnerable people, to even weaker persons with poorer technique and lesser understanding. So we try and filter that down where possible, and I think as healthcare providers or as parents and whichever, or managers or football managers or coaches, whoever might otherwise be here, we all need to be alert to that circumstance and have a deferral point. It's in the lexicon right now of our thought in terms of what's happening with concussion and where we otherwise go. And I think it's really incumbent upon all of us to otherwise, if we are involved in any of that sort of type circumstance, to be sure of what to do. You know, if you have no policy, your policy should be, I have no policy, yeah? If you're in a situation where you otherwise see people like this, and unfortunately some of the associations like the AFL, like the NRL, have now made a burden upon lots of healthcare professionals that in order to go back to return to play, you need to be signed off by a healthcare professional who understands. And that's really difficult because they'll often ring you on a Friday night and say, hey, Johnny's playing on a Saturday morning, can you please sign off on him? Yeah? We need to teach these people that they need to seek people straight away. We need to teach the people who are doing the sport that you need to refer straight away. Someone needs to take responsibility, not just an emergency department for 4 hours to observe to see whether they're going to decline and get worse. Jacob, when you went back to sport, what happened?
So it was gradual return of the sport. So start off with just light exercising, making sure that I could do that.
When you went back and you played, what happened? A few weeks later or a month later?
Oh yeah. I ended up getting another head knock. This time it was more a stick to the head. But thankfully, this was in tournament as well. So I've gone to nationals to Tassie, and we've gone for gold. And then in one of the playoff games, I got a friendly fire stick to the head. And I kind of obviously doing this situation before, I was really cautious because I did not want to have another 2 months off hockey. And I remember when Jason, when I saw him for my last time, he said that if you get another one, then you're really pushing the boundaries. But he was adamant that he said he will not let me get another one after that. So he said no more than 2. And I was like, oh shit, okay. So I made sure I protected my head pretty well. But then this freak accident happened where the stick just came off and hit my head. So I took myself off straight away. I spoke to the team physio for Hockey Victoria, and he was like, okay, he knew my past with concussion. He did the SCAT 5, and he actually said that, I can go, I was cleared to play. And then I went back on, and I still just didn't really feel that right, so I just took myself off again. And after the game, I saw Mum, and I was like, after the game, I actually had a vomit in the toilet, just because of the feeling of being sick, and probably another concussion. I saw Mum, and I just broke down in crying because I was like, I know I've got another concussion. But thankfully, because in those state tournaments, you stay with the team, so I ended up staying with Mum for the next couple of nights and just slept again straight away because that's the best thing you can do, just rest. I slept for the next 2 days, and thankfully, doing that, I was able to recover a lot better. Considering the first time when I had it, I ended up playing the rest of the game, drove home, played the next day, so that obviously made things a lot worse compared to this time. I was able to rest straight away, and then when I came back, I think I saw Jason, and it was still a mild concussion, and I still took another 2 weeks off just for extra precautionary. That was a lot better compared to the first time.
Cool. So moving forward, Jacob, what are your thoughts towards concussion and how do you see it now?
I think the first main important point is like the first line of protection, especially in community sport. So like I feel like if I had like a physio or a doctor, obviously not a doctor, but like a physio that like knew stuff about concussion when I first came off, just to like assess everything properly, that would have been helpful. Because when I come off and the first thing they're checking is my ribs, was a bit like, okay, so I didn't really think anything of concussion. And then I'd say also like there's a lot of like negative culture around it, especially in not just hockey but in all sports as well. Like the mentality of like you got to be tough. Like concussions aren't really as like a big injury; they're a bit of soft. So that mentality kind of needs to be stamped out of all sports and society, and also just like following the proper
Protocols.
Yeah, protocols, that's the word. Obviously, like, you see freak incidents, like, on the footy as well. There was another concussion on Thursday, and, like, you kind of just, like, your heart sinks, really, because especially when you know you've gone through it. So, because it's not so much like, yeah, the injury is going to be hurtful and stuff like that, but it's also, like, the process of, you know, he's going to be out for at least 4 weeks. So, yeah, I think it's really important that you follow the protocols and you do everything properly to minimise the risk of it happening again. Because obviously now you see like there's a lot of cases that are coming out with CTE and all those bad problems about that. So yeah, I guess the main thing is just following the protocols.
I think it's interesting that Jacob mentions that CTE sort of circumstance, and I'm not smart enough to discuss that, to be brutally honest. But certainly the narrative is driven a lot by CTE and around what we do know, but more particularly about what we don't know. And I think that's probably a nice segue to sort of lead into the next group of presenters who will be able to hopefully share a lot more insight in terms of what's happening in terms of research and where we're taking concussion nowadays. But Jacob, thank you so much for coming in today.
We do have some burning questions, if there are any in the audience. Otherwise, we can go to the next session. Are there questions that simply can't wait until the dedicated 45 minutes we have for panel discussion?
Cameron Munster will be back in 2 weeks. No, that's okay. It's an NRL joke. It's okay, sorry.
I was also going to say I would give the prerogative to Mum and GP. There you go. So,
thanks, Nick, and thanks, Jacob, for your presentation. I think the points that I'd like to just emphasise from when I saw you on those 2 occasions, 2 days after the first hit and then 6 days later, was how unsure you were about everything that was going on around you. And I can just quickly glean that you weren't right? Now some of your CNS testing was pretty much okay. You mentioned the robberies and the catch, but then even later on that week it had improved. But it was as if you were in the room listening but not really listening. And then it was only when I said, no, we can't I want you to take the week off, that you really sort of showed some emotion, and I knew how important the state training was, and there was a real pressure and a real expectation that hopefully Take 2. That's better. There's a real expectation on your part that you were going to, you couldn't put that at risk, and so there was, there was a subtle pressure on me to really try and find the way that I could assist you to deal with the situation. But clearly, by that Friday, after the original Saturday injury, it was clear that you were still in need of Jason's attention. That's all.
again, please thank Jason and Jacob.
Stay here. Sit down. Yeah.